you learned a lot this weekend, and to strengthen our acquired knowledge, we asked for some help. Dr. Niklas Schönegger is a Sono Graz alumni, and he will take a Sono quiz with us now.
So, hello everyone. Thanks for the kind introduction. My name is Niklas Schönegger. I am a resident physician on the Department of Internal Medicine at LKH Graz II. And I'm happy to do the Sono quiz with you. In the last days, you heard about common problems in general medicine. I will, together with you, discuss a few cases of patients with dyspnea, pain, and fatigue. I think you had a great opportunity the last days to train your imaging skills, to know how to look at how the normal anatomy of the organs is. And now start with the first patient. The first patient is a 20-year-old male who comes to you with shortness of breath since 3 hours. In his medical history, he had bronchial asthma, and he also suffered from pneumothorax 2 years ago, and 10 years ago, he also had myocarditis. So this is what you got when you put the probe on his chest. And I now want to know from you, what did you see on the clip? Was it a normal lung sliding on both sides, pneumothorax on the right side? Was the clip acquired with a phased array? Or was the pneumothorax on the left? Or was more than one answer correct? So I now please you to raise your hand if you think there was normal lung sliding on both sides. Okay. Do you think there is pneumothorax? Oh, sorry. Do you think there was pneumothorax on the right clip? Was this clip acquired with phased array? Is the pneumothorax on the left side, or is more than one answer correct? So, do you think pneumothorax on the right? Okay. Was this clip acquired with a phased array? Does anyone see a pneumothorax on the left side? Okay, one. Or is more than one answer correct? Okay. Most are not sure. Okay, if we check on the images, we see that the clip was acquired with a linear probe that you see here on the footprint. On the right side, you see here rib shadowing and normal lung sliding with comet tail artifacts. So we have no hint that here might be a pneumothorax. On the left side, there is absent lung sliding. So this is a pneumothorax on the left side. So the correct answer was D. The next case is a 74-year-old male patient who presents with you with shortness of breath on exertion, increasing over the past 2 weeks. In his medical history, the patient had a myocardial infarction 5 years ago. So this is a clip that you get when you put the probe here in his right upper quadrant. And I want to know from you, what do you think this might be? Is everything okay? The patient exaggerates, there is no pathology. Does the patient have maybe a pleural effusion? Pericardial effusion? Is more than one answer correct? Or do you see the spine inside the thorax on this image? So please raise your hand if you think everything is okay. No one? Does anyone think that there is a pleural effusion? Okay. A lot. Does anyone see pericardial effusion? Does anyone think that there's more than one answer correct? Okay, 3, 4, 5, 6. Does anyone see spine here? 1, 2, 3, 4, 5, 6. Okay, a few. So let's check again. You see here, oh, sorry. You see here the liver. This is a pleural effusion. And also you see down here, this bright line is the spine, which you can see inside the thorax. So the correct answer is D. This is also called spine sign. This might be helpful in small pleural effusions, where you not see this large amount of fluid, only inside here some spine. This might be helpful. So the next patients present with pain. A 49-year-old woman presented with increasing pain in the left lower leg for 3 days. The pain was constant. She had no remarkable medical history. So you put the probe on her lower leg, and this is what you got. And again, I want to know from you, what do you think this might be? Is this a hematoma? Is this a Baker cyst? Is this a deep vein thrombosis? Is more than one answer correct? Or do you think everything is okay, she can go home, no problem? So if you think this is a hematoma, please raise your hand. Okay, no one. Baker cyst? Oh, no one. Does anyone think this might be a deep vein thrombosis? Okay, almost everyone. Does anyone think that there's more than one correct answer? No one. And does anyone think everything is okay? No one. Okay. So the correct answer is, this is a deep vein thrombosis. Oh, sorry. So you see down here the popliteal artery and here the popliteal vein. And the vein has a larger diameter than the artery, and also there's no flow, and this more hypoechogenic material inside the vein. This is classical for a thrombosis. The next case is pretty similar. It's a 43-year-old male with also pain in the left lower leg and swelling since 3 days. He has a history of alcohol addiction. He drinks a lot of liquids a day, and he also had suffered from steatohepatitis. This was his history. And again, you put the probe on his lower leg to help you a little bit. This was here down in this region. Now I want to know from you, is this maybe, again, a deep vein thrombosis, because the patient had the same symptoms as the last patient? Do you think this is okay, the patient has no problem? Maybe he has a hematoma in lower leg? Do you think this clip was acquired with a phased array? Or do you think more than one answer is correct? So if you think this might be a thrombosis, please raise your hand. Okay. Do you think everything is okay? That's normal on the lower leg. That's how it looks like. Do you think this might be a hematoma? Okay, the majority. Do you think this clip was acquired with a phased array? Okay. And does anyone think more than one answer is correct? Okay, no one, I think. So if you have a look, this clip was acquired with a linear probe. We have no vessels here, so that couldn't be a DVD. A DVD is inside a vessel. And you see a sharp bordered structure with echo-free and hypoechogenic content. In this case, it was a hematoma in the lower leg. And the patient got this because he has thrombocytopenia, because of his liver disease. The next case is a 45-year-old male who presented with fever, pain in the right upper quadrant, and jaundice since 2 weeks. Also, this patient had a history of alcohol abuse. Maybe this is because of why he waited 2 weeks with going to hospital because of jaundice. This is normally a symptom which leads patients very, very quick to doctors. And this was the image here of his abdomen, of the liver. And take a look on it. And I want to know from you what this might be. Is this maybe a cholestasis? So obstruction of the biliary system. Is everything okay? Does it look the same like you trained the last days? Is it a thrombosis of the liver veins? Was this clip acquired with a linear array probe? Or is more than one answer correct? So who think there is obstruction of the biliary system, cholestasis? Yeah, 1, 2, 3, 4, 5, 6. Yeah? Who think everything is okay? Would be too easy. Do you think there is thrombosis of the liver veins? Okay, no one. Was this clip acquired with a linear array probe? No one. And is more than one answer correct? Who thinks? Okay, no one. Okay, this is a very tricky example. So you see, here is the liver. This here, the structure, is the common bile duct filled with sludge. Down here you have the portal vein. And you see that the common bile duct is dilated. And also the dilatation goes into the smaller bile duct. So this is a typical sign for obstruction of the biliary system, for cholestasis. And the next point was the liver veins. You see here the blue structures are the liver veins. Pardon. Are the liver veins in which you can see flow. So you have no hint on this image clip of liver vein thrombosis. But this clip was in fact acquired with a linear probe, although it was in the abdomen because the patient was very slim. So we put the linear probe on it and widened the area of interest. This you can see here on the footprint. Because the normal abdomen probe has a convex footprint. The next patient is a 45-year-old male with very severe pain in the left upper quadrant here for 2 hours. He also had no remarkable medical history. And this is the image you acquired. And what do you think about it? Is everything okay? Are there signs of hydronephrosis or simple kidney cysts? Is there free intra-abdominal fluid, or is again more than one answer correct? Who thinks everything is okay? No one. Who thinks there is hydronephrosis? Okay. Majority. Who thinks there are kidney cysts? Okay. Who thinks free intra-abdominal fluid? No one. And who thinks that there's more than one answer correct? Okay. So you see here the left kidney, and here at the pelvis of the kidney there is this sharp echo-free structure that have a connection to the ureter. So this is hydronephrosis. These echo-free structures all are connected together, so we have no hint that there might be kidney cysts. So this is classical hydronephrosis. We also have no hint on this clip for intra-abdominal fluid. So the correct answer is B in this case. Next patient is a 47-year-old female patient, also with pain in the right upper quadrant for 3 days. She also had fever, but no jaundice. She treated herself with analgesics, but that doesn't went very well. So she presents to you. In his medical history, she's overweight and she had 2 cesarean sections. So, and again, you put the probe on the area where she has pain, and this is what you see. So what do you think you can see on the clip. Is it inflammation of the gallbladder? Do you think this is a liver abscess? Is everything okay again? Is it a gallstone, or is more than one answer correct? So who thinks there's cholecystitis? 1, 2, 3, 4, 5. Liver abscess? No one? Is everything okay? No one? Gallstone. Does anyone see a gallstone? 1, 2, 3, 4, 5, 6, 7. Yeah, a lot. Is more than one answer correct? Ah, okay, this is the majority. So we see here the gallbladder. In the gallbladder, there is this hypoechogenic structure with dorsal acoustic shadowing. This is a gallstone. Also, you see here the wall of the gallbladder is thickened. It's about 1 centimeter. Normally, the gallbladder wall should be up to 4 millimeters. So this is also you see multiple layers of the gallbladder. So these are classical signs for cholecystitis. So the next patient presents with fatigue. In this case, a 40-year-old male presented to you with fatigue for 6 weeks. He also describes some shortness of breath on exertion and leg edema. In his medical history, he had impingement of the right shoulder for years, and he also reported that he had a respiratory tract infection 3 months ago. That was everything he could tell you. And this is what you got when you put the probe on his heart. Pardon? So, what do you think is the problem of the patient? Does the patient have pericardial effusion? Is everything okay? No pathology from the heart? Is the right heart much larger than the left heart? May this patient have pulmonary embolism? Has this patient a poor left ventricular function? Or is more than one answer correct? So who thinks there is a large pericardial effusion? Who thinks everything is okay? Who thinks that the right heart is larger than the left heart and this patient might have pulmonary embolism? Okay, and who thinks the patient had a poor left ventricular function? Okay, perfect. And who thinks more than one answer is correct? Okay, no one. So here in the subcostal view of the heart, you see the heart. Here you see the pericardium. There's no hint of a pericardial effusion. You see a small left ventricle, so you have no hint of a pulmonary embolism. And down here you see the left ventricle with a poor function. So the correct answer is D. The patient had a poor left ventricular function. This patient turned out to have myocarditis. So the last case is an 18-year-old male patient who also presented to you with fatigue. You know him because he's a football player in your town, and you check him with sonography. His heart and his lungs were okay, and you made abdominal ultrasound and found this. So I now want to know from you, what do you think, can you see on this image, has this patient a large spleen? Has he massive free intra-abdominal fluid? Maybe some bleeding, and because of that he's fatigued? Is everything okay? He's just exhausted. Does this patient have a spleen hematoma, or is more than one answer correct? So who thinks the patient had a very large spleen? Okay, majority. Who thinks there is massive intra-abdominal fluid? No one. Does anyone think that there's everything okay? Okay. Does anyone see a spleen hematoma here? No one. Or is more than one answer correct? No. So the correct answer is the patient has a large spleen. You see here, when you look at the numbers, that they're 20 centimeter diameter. that's far too much. You maybe see here some free intra-abdominal fluid, but that is not massive, and you have to check it with the probe if there is true intra-abdominal fluid, so you can't tell exactly if there is some on this picture. Spleen hematoma, this is no spleen hematoma. This is shadowing because of the rib here. You also see that it's going down here. So, I hope you had some fun with the quiz. I thank you for your attention.
Thank you. Are there any questions? Okay, perfect. Thank you again.
Danke sehr. Danke. Hey, cool.
Now we ask Vanessa to come to the stage because she will announce the winner of the workshop picture.
Okay, so hello everybody. As promised, we have a lottery for you, for everybody who participated in the workshop, and you all did a really great job with this, so congratulations to all of you. You all saved the patient and you took some awesome photographs, which we're going to show you in a minute, or right now. Yeah. Let's have a look. Going to be there shortly. Okay, number 1. Number 2. And last but not least. So as you can see, they've been all so great. So of course we could not decide, and that's why we're going to let this box decide, or Esther. Esther, you may choose one group who's going to win the books. And the winner is group number 6. Who's that? It's you in the front, right? Okay, you may stay seated, and why don't you just pop by the workshop room after everything is finished, and then you'll get the books, okay? Thank you, everybody. You're all winners, basically, and I hope you enjoy the workshop and the entire summer school. Now I'm going to head the microphone over to Lisa.
So then, that was it. Our 7th late summer school of ultrasound has come to an end, and we hope that you all enjoyed it a lot and that you learned a lot as well. We also hope that we could spark your interest in ultrasound, that we could motivate you for further practice. If you're especially interested in becoming part of Sono Graz, please just check our Facebook and Instagram page, because we're soon going to be looking for new tutors. So just check on it regularly.
Before we say goodbye, we want to say a big thank you to, first of all, Christoph for doing the live stream this whole weekend. He's up there. And also a big thank you to Georg and Emil, who coordinated the summer school, and especially to Georg, because he did not only coordinate the summer school, but did all the technical support and coordinated the workshop. Thank you. And thank you all so much for being part of this event. And now we wish you a nice Sunday and be healthy.